Welcome to the Caregiver-Centered Care Competency-Based Education for LPNs and Partnering with Family Caregivers During a Pandemic webinar.
Dr. Parmar is a care of the elderly physician and has worked for the Specialized Geriatrics Program since 1992. She is a professor in the Department of Family Medicine at the University of Alberta and medical lead of home living and transitions for the Alberta Health Services Edmonton Zone. Dr. Parmar has been very active in developing and implementing clinical programs for the care of the elderly with complexities and frailty. Her research is currently focused on supporting family caregivers of older adults. Please join me in welcoming Dr. Parmar.
Hello everyone, my name is Dr. Parmar and I'm honored to present this webinar to you. This webinar will explore why it is important to support family caregivers, the consultations that informed the development of the education, the competencies licensed practical nurses can apply to support family caregivers, and the opportunities for LPNs to become caregiver-centered care champions. You may be thinking, why competencies related to caregiver-centered care are important? It is because these competencies help us as healthcare providers to understand how we can support family caregivers when we interact with them. In your workplace settings, whether it be primary care, acute care, home care, supportive living, or long-term care, licensed practical nurses work with family caregivers. You can use these interactions with the knowledge you will gain from acquiring these competencies to support family caregivers. Also, many of you will also be family caregivers yourselves. Well, the next question is, why do family caregivers need our support? The answer lies in that family caregivers are the invisible workforce in our society and the backbone of the healthcare system. Currently, 1 in 4 Albertans are family caregivers, providing close to 400 million hours of unpaid care each year, 10 times more than amount of paid care that is provided. And it saves the Alberta healthcare system approximately $5.8 billion per year. Family caregivers have always stepped in and up to providing care. Unfortunately, family caregiving can lead to negative impacts on the caregiver's mental, physical, and financial health. 60% of family caregivers are working, which makes family caregiving even more onerous. Loneliness and anxiety in family caregivers have been steadily increasing over the years and have exponentially increased during this pandemic. We have fewer family caregivers, longer care trajectories, and we are supporting people to age in place. We are increasingly depending on family caregivers, and we need to support family caregivers not only to sustain care, but also to help them maintain their own health and well-being. Having recognized the need to support family caregivers, we started to explore the role of the healthcare system to support them. In the last 7 years, we have engaged over 400 multi-level interdisciplinary stakeholders, including researchers, policymakers, healthcare providers, community organizations, and family caregivers in a cross-sectoral dialogue about how to support family caregivers. In 2014, at a first symposium, we learned that very little was being done to support family caregivers from within the healthcare system. Family caregiver support was left primarily to community organizations, and that we were mostly focused on patients and their care. In 2016-2017, our multi-stakeholder meetings shed the light on the missed opportunity from within the healthcare system to support family caregivers and the need to educate the healthcare providers to support them. In 2018-2019, we came together to inform the education needed for healthcare providers to support family caregivers and the competency-based Caregiver-Centered Care Framework was born. Finally, in 2020, we created the foundational education, which now has been released for everyone to use. Let me share the Caregiver-Centered Care Competency Framework with you. It consists of 6 domains, and each domain consists of 3 to 5 indicators. The domains are recognizing the caregiver role, communicating with family caregivers, partnering with family caregivers, fostering resilience in family caregivers, navigating health and social systems and accessing resources for family caregivers, and finally, enhancing our own culture and context of care. All the education created serves to enable healthcare providers to acquire these competencies. There are 3 competency levels. First is the foundational level, which is a 1-hour course for healthcare providers in all settings who interact with family caregivers. This is available now. The advanced level of education is for those healthcare providers who spend considerable time with family caregivers or have significant responsibility for caregivers in their role. Lastly is the Champions Education. And this is for those healthcare providers who would like to model and mentor caregiver-centered care, facilitate dissemination of this education, and sustain it. Planning for the foundational competency-based education started in 2019. In 2019, when we validated the competency-based framework, we got the message that we've got to do something that makes a difference. We should get really innovative and try to make people understand in their soul that caregivers are vital somehow. In 2020, we co-designed the competency-based education. Co-design is the act of creating with stakeholders to ensure the results meet their needs and are usable. A co-design approach enables genuine engagement of stakeholders, and we had close to 100 multi-level interdisciplinary stakeholders, including family caregivers, health and community care providers, policymakers, researchers, designers, create this education. I can say with confidence that you will relate to the caregivers and the healthcare providers and their journey in this course. In the foundational caregiver-centered care education, you will view 6 videos aligned with the 6 competency domains. The videos follow Lacey, a student nurse whose mother has been diagnosed with early onset dementia. She learns about how to support family caregivers from her colleagues. The education is free online on our caregivercare.ca website. This foundational education takes about an hour. And now I'm going to give you a taste of the Domain 2 communication video.
When I was still a student nurse soon to graduate, my need to understand family caregiving was urgent for reasons both professional and personal. We'd only recently learned that my mother had young onset dementia. It was a diagnosis that changed my life as much as it did hers. Luckily, I knew other healthcare providers like these: Dr. Davina Collins, case manager Cloris Mitty, and social worker Edward Mance. They had professional experience in working with caregivers, and at that point in my life, I soaked up every word they had to share.
What surprises me is the sheer volume of tasks necessary to take care of my mom. I'm training to be a nurse, and it amazes me how much there is to do. I don't know how to keep up with it all.
I felt that way too. My confidence in providing adequate care ebbed and flowed, but
life found a way.
When I think about my career, it's astounding how much my attitude towards family caregivers has evolved. I used to avoid talking to them. I thought that by interacting with them, it got in the way of time with my client.
You're here.
Got in the way, but caregivers are the ones who do most of the work.
Well, you're just starting out in your career. We've been around long enough to have seen how caregivers have evolved. The perception of caregivers have evolved, and that evolution continues.
I don't think I understand.
Well, you see, when I first started out as a social worker, my primary focus was that to the person I came there to see, the care recipient.
Of course.
Yeah, I know. Well, at least I know now. I think my focus was a little too narrow.
As I come close to the end of my presentation, I'm going to request for your involvement. In Benjamin Franklin's words, tell me and I forget. Teach me and I may remember. Involve me and I learn. I hope that you will get involved. There are many ways you can become involved. You can take the foundational education and receive a certificate. This is available now and ready for your taking. You can participate in the co-design process for the advanced level education as well as champion education. Please reach us through CLPNA and we will engage you. You can become a caregiver-centered care champion. Once again, identify yourself to CLPNA and we will reach out to you. We have the means to train and support you. Our goal is that all family caregivers should feel supported by us from within the healthcare system throughout their caregiving journey. Thank you for your attention and all the best.
The COVID-19 pandemic has increased stress for family caregivers, and the health workforce can be the first line of reliable support. The Caregiver-Centered Care education, partnering with family caregivers during a pandemic, highlights the impacts a pandemic can have on family caregivers and provides practical solutions for partnering with family caregivers to assist in navigating the uncertainty caused by a pandemic. You will learn how to understand the impact of a pandemic on family caregivers, how to empathetically understand and communicate with family caregivers, and how to navigate the uncertainty for providing care together with family caregivers during a pandemic. This supplementary education includes 3 modules that take approximately 45 minutes to complete and provides the learner with a certificate of completion. Alberta LPNs can access the member-only foundational level Caregiver-Centered Care learning module and the Partnering with Family Caregivers During a Pandemic supplementary module through their MyCLPNA member login. Non-members can access public course information at www.caregivercare.ca. Thank you for viewing this presentation. If you have any questions, please contact the CLPNA Professional Practice Team by going to the CLPNA website, click on Contact, and then Ask CLPNA. Fill out the form and click Submit. Thank you.